Hi everyone, in this video I'll give you a brief overview of acromegaly. For some key background information, acromegaly is a rare hormonal disorder that occurs when the pituitary gland produces too much growth hormone after the normal growth period has ended. It causes the growth of extremities as well as some endocrine disruption. And in most cases, it is caused by a non-cancerous tumor in the pituitary gland called the pituitary adenoma. Very importantly, it is a chronic condition and does not occur within a day, and the symptoms can take months or years to notice. As previously mentioned, the main cause of acromegaly is the overproduction of growth hormone due to the presence of a pituitary adenoma, where it secretes excess growth hormone that then stimulates the liver to produce the insulin-like growth factor. However, less commonly, acromegaly can be caused by tumors in other parts of the body that simply produce growth hormone-releasing hormone, also called GHRH, which stimulates the pituitary gland to produce the growth hormone itself. In rare cases, acromegaly can also be caused by genetic mutations that affect the regulation of growth hormone secretion. In terms of the pathophysiology, the growth hormone stimulates the liver to produce something called the insulin-like growth factor 1. Insulin growth factor 1 acts on bones and body tissues, promoting the growth of bones, which results in the typical features of acromegaly. In terms of the clinical presentation, you can have a variety of symptoms which develop gradually over time. However, the most common symptoms include coarsening of facial features, as you can see on the image here, bitemporal hemianopia, which is where the pituitary tumor presses on the optic chiasm, causing visual field defects. You get joint pain and feet growth, as well as brow protrusion, which you can see on the images there. Other symptoms to be aware of include sleep apnea and snoring, fatigue and weakness, menstrual irregularities in women, as well as excessive sweating and body odor. It's important to note that not everyone with acromegaly will experience all of these symptoms, and some people may not experience any symptoms at all, and therefore it is important to spot the diagnosis early in order to prevent all the complications, which are often irreversible. In terms of investigations, the first one is the serum IGF-1 levels, and in patients with acromegaly, they should be elevated. If a patient has raised IGF-1 levels and they have symptoms of acromegaly, their oral glucose tolerance test should be performed. It confirms the diagnosis if the IGF-1 is raised. And essentially what you do is you give glucose to a patient and see whether there is growth hormone suppression. And in patients who do have acromegaly, there will be no suppression happening after the test. You can also perform a random serum growth hormone test, which in itself is not diagnostic, but it should be raised in someone with acromegaly. And it typically would be over 1 microgram per liter in those patients. Lastly, if you suspect a pituitary tumor, you can help visualize it using an MRI head. In terms of management, you have medical management, which includes things such as octreotide and lacretide, which are somatostatin analogs, which help inhibit the release of growth hormone. You have something called pegvisomant, which is a growth hormone antagonist. And lastly, you have things such as dopamine agonists, which include bromocriptine. You also have surgical management, which is the trans-sphenoidal surgery, and that is often used actually first line in patients who are fit enough for surgery. This has been a brief overview of acromegaly as a condition. If you have any questions, feel free to leave them down in the comments. Other than that, thank you so much for watching, and I hope this has been useful and you consider subscribing.